I have heard dozens and dozens and dozens of stories from caregivers. The stories about wound care were really startling because people were being sent home to take care of post-surgical wounds without any basic infection control training, without any understanding of what they were supposed to do. And there's a considerable ick factor in this, in doing this, even if you want to do it. What I'd love to see happen is a much more comprehensive and sensitive way of teaching family caregivers to do the kinds of tasks that for some of them are really, really difficult. And they do make mistakes, and they know they make mistakes. But often when they call and say, I'm not sure, I didn't give the medication at the right time. Should I give another pill, not another pill? Oh, don't worry about it. That's not a good answer. You need someone to say, well, let's see, when did you give it? Well, let's see, let's wait until the next one, or is there some way you can now make a calendar so that this doesn't happen again? Instead of sort of brushing it off as it doesn't matter. It's interesting that in all of our discussions, I've found that family members look to the physician. In my experience, family members don't think something is real unless the doctor says it's real. They're still the authority figures, and no matter how many other people are around in the environment, in doing different jobs and doing jobs well, if the doctor doesn't say this is the way it should go, it isn't done. So there is a major role for the physician. On the other hand, the physicians don't seem to be involved at all in the kind of training that goes on. That's more or less left to nurses, and they can do that. But I think there would be more. Family members would feel better if the physician were also involved, at least in explaining what's going to happen, and then the nurse or the physician's assistant or whoever it's going to be is going to walk you through it. But I want you to know that this is really important for your mother or whoever it is to feel that they have a stake in it too, rather than just saying that's not, I don't have time for that. People want the sense that the physician knows what's going on and that you can call them with questions. So I think physicians can play a much bigger role. I would like to tell physicians that the family member who accompanies your patient to the visit is a critical person in that patient's care, that you need to work with both of them to arrange a way of transmitting information and listening to both of them about how the care is going, that they are in it together, and you can help both of them do a better job of managing medications, of keeping up with diet, or whatever the thing is. That the family member is not a visitor. The family member or transportation person. The family member is the family caregiver is a critical part of the patient's care and needs to be engaged. There are issues of privacy, there are issues of autonomy, but you can work those out if you see that this person is essentially part of the care team, and you need to involve them in the care plan. The Next Step in Care website, www.nextstepincare.org, has guides for family caregivers, about 25, in 4 languages and free. The provider side has a whole range of guides it's a toolkit on how, particularly about managing a hospital discharge, with Project RED, which is a major transition program out of Boston Medical Center. We did a special chapter for their protocol on how to work with family caregivers, identify the right person, assess their needs, talk to them about what the care is, find out what their strengths and capabilities are and what their need to care at home, and follow up. So there is a robust set of materials on the website for providers, and I think they are used, and we do think that they're very simple, they're very straightforward. This is all you need to do. Do these things, and you're going to be in much better shape.